Hey guys, welcome back. Today, I'm Cupid, sorry, and I have schizophrenia. Almost forgot that. Today, I wanted to talk about anxiety with schizophrenia, um, kind of go over why it happens, kind of the relationship between the two, things like that. So, have some things, some different articles. I did look at mainly scholarly articles. I don't know if anybody knows what that is, but that is something that is scholarly articles are journals that were written by professionals and were also peer reviewed by professionals. So let's go over some of these. So, anxiety is frequently observed among patients with schizophrenia. Anxiety may present as a component of schizophrenia. Um, Particularly during the acute psychotic episode, the result of an underlying organic condition, a medication side effect, or a symptom of a co occurring anxiety disorder. Anxiety symptoms can occur in up to 65% of patients with schizophrenia, which I thought was unique because I thought that almost all patients with schizophrenia had um, anxiety, and may reach the threshold for diagnosis of various comorbid anxiety disorders, including obsessive compulsive disorder and post traumatic stress disorder. And like I talked about in a previous video, um, most people with schizophrenia have some form of OCD or PTSD, and that schizophrenia can also cause PTSD because of the symptoms. Things that you see, hear, feel, whatever, those can create PTSD. Um, the prevalence of an anxiety disorder in schizophrenia is estimated to be up to 38%, with social anxiety disorder being the most prevalent. Severity of positive symptoms may correlate with severity of anxiety symptoms, but anxiety can occur independently of psychotic symptoms. While anxiety may be associated with greater levels of insight, it is also associated with increased depression, suicidality, medical service, utilization, and cognitive impairment. Patients with anxiety symptoms are more likely to have other internalizing symptoms as opposed to externalizing symptoms. Diagnosis of anxiety and schizophrenia may be challenging, with positive symptoms obscuring anxiety, lower levels of emotional expressivity, and the communication impeding diagnosis and conflation of akathisia. I don't know if anybody's ever had akathisia. I have had that. It is one of the worst feelings in the world you can ever experience. I don't know if you guys know exactly what it is or what it does, but it causes your body to feel a restlessness consistently. Um, it's like makes your legs shake, your body shake. It makes you feel like you can't sit still. You have to be doing stuff, and even when you're doing stuff, it's not enough. You have to be doing more, and you have to change up what you're doing. And it's a really hard feeling to have. I've had it multiple times from medications, and it is terrifying. It is terrifying. Higher diagnostic yield may be achieved by assessment following the resolution of the acute phase of psychosis, as well as by the use of screening questions and disorder-specific self-report instruments. In schizophrenia patients with anxiety, there is evidence of underactive fear circuitry during anxiety-provoking stimuli, but increased autonomic responsivity and increased responsiveness to neutral stimuli. Recent findings implicate the serotonin transporter genes, brain-derived neurotrophic factor genes, and the serotonin 1A receptor, but are preliminary and in need of replication. There are few randomized controlled trials of psychotherapy for anxiety symptoms or disorders in schizophrenia. In medicine, a prodrome, I'm going over what a prodrome is or prodromal because I've said that a few times and I'm also going to be saying it again. Um, I didn't know what it was at first. I don't know if any of you knew what it was. but I am going to describe what it is. A prodrome is an early sign or symptom or set of signs and symptoms that often indicates the onset of a disease before more diagnostically specific signs and symptoms develop. It is derived from the Greek word prodromos, meaning running before. So that's like that stuff that I told you guys about that starts happening before the Big Bang. In the prodromal phase of schizophrenia, severe alterations of the visual appearance of the environment have been found, accompanied by a state of intense anxiety. The present study considers the possibility that these alterations really exist in the appearance of objects, but that healthy people do not see them. The image of the world that we see is continuously deformed and fragmented by foreshortenings, partial overlapping, and so on, and must be constantly reassembled and interpreted, otherwise it could change so much that we would hardly recognize it. Since pleasure has been found to be involved in the visual and cognitive information processing, the possibility is considered that anhedonia, the reduction of the ability to feel pleasure, might interfere with the correct reconstruction and interpretation of the image of the environment and alter its appearance. The possibility is also considered that these alterations might make the environment hostile, might at times evoke the sensation of being trapped by a predator, and might be the cause of anxiety that accompanies them. According to some authors, they might also induce delusional ideas in an attempt to restore meaning in a world that has become chaotic and frightening. Various comorbidities are common in individuals with schizophrenia, including anxiety disorders. It is well established that panic disorder, obsessive-compulsive disorder, and post-traumatic disorder are prevalent in this population, and treatment of these comorbid conditions has been linked to improved outcomes. Emerging evidence has begun to elucidate the prevalence and outcomes associated with social anxiety disorder in schizophrenia. Findings thus far have demonstrated greater disability, elevated rates of substance abuse, lower quality of life, and a higher risk for suicide in patients with comorbid SAD or social anxiety disorder. In a study published by Lohengruber et al. In 2015, 38% of randomly selected sample of adult outpatients with schizophrenia or schizo-affective disorder was found to have comorbid SAD, as determined by cutoff score by 29 out of 30 on the total Leibowitz social anxiety scale score. A lot of big words. Just kidding. The present. I think I have same issue I was having yesterday trying to speak. The presence of anxiety disorders in persons with psychotic disorders is gaining increased attention. The evolution of diagnostic criteria and the different editions of DSM has contributed to an increased awareness of these comorbidities. For instance, in DSM-3, an anxiety disorder could be given only if anxiety was clearly not due to another axis 1 disorder, while in DSM-3R and DSM-4, diagnosis was allowed if anxiety was unrelated to or not better accounted for by the main diagnosis, respectively. While such criteria allow a comorbid anxiety disorder diagnosis in persons with schizophrenia, overlaps between the symptoms of anxiety disorders and those of psychosis may complicate the application of these hierarchical rules. There is a close relationship between anxiety and schizophrenia. Anxiety often precedes and accompanies schizophrenia and is one of its risk factors. Longitudinal studies have shown that anxiety precedes paranoia, and this seems to exclude the possibility that paranoid ideas can be cause of anxiety that accompanies schizophrenia. A possible relationship between, I think we talked about this already a little bit in the things that I'm talking about here. But they found that the disturbances in what we see can cause anxiety. So the disturbances in like not being real, I guess, the things that are not seen by others can cause anxiety. So I think actually this itself says this, but a possible relationship between disturbances in perception of the aspect of the environment and anxiety seems understandable since an unexplainable alteration of form such as that found at the beginning of schizophrenia could render the environment different and unknown, and this might justify the onset of an anxious state. For example, an unknown environment is used as a stimulus to cause anxiety in experiments on animals, and it is sufficient to provoke a dramatic experience of anxiety. Moreover, distortions of the visual aspect of objects could make the environment not only new but also inexplicably, inexplicably, sorry guys, inexplicably deformed, and for that reason all the more dangerous and frightening. However, perhaps it is not necessary for the visual deformations to be caused exclusively by visual problems. Perhaps the images we see are in reality already deformed, only we do not normally notice it. In fact, the image of the world we receive through what we see has to be continuously reassembled and reorganized, otherwise, it could become distorted and fragmented and could change so much that we could hardly recognize it. Very interesting, actually. That even people without schizophrenia could have deformities in what they see because we are already in our brain trying to put together everything that we see and trying to analyze and create what it is. And I think that it makes sense. Our brain um, puts together what we see. What our brain is exactly the thing that brings to life everything that is being visually like impacted and whatever. You get what I'm saying? I think. However, perhaps it is not necessary. Oh, that was just the one I read. Even in a person without psychiatric pathologies, the sudden awareness of a deformation of the appearance of the environment, deformation that had always been present but had previously been ignored, may give rise to intense anxiety. An example of this can be found in The Art and Visual Perception, a book by Arnheim, former president of the Division on Psychology and the Arts of the American Psychological Association, where the author describes the distressed reaction of a student when following a suggestion by the teacher. She became aware of the deformations. This is a student, by the way, who does not have schizophrenia. She became aware of the deformations assumed by the appearance of an object according to the viewpoint from which it was observed, deformations which she had always corrected automatically without realizing it. That's kind of interesting. So our brain automatically corrects the deformations in our environment, which makes sense because we only see what our brain allows us to see. So it is very difficult for many persons to visualize the working of perspective, even when it is demonstrated to them with a yardstick. So, there we go. That is amazing stuff that I learned myself and amazing things that I hope that you guys learned from this. And I hope that you guys can hear me today. I know that yesterday I had some issues with the sound, and I apologize. I recorded it thinking that everything was fine, and then when I went and watched it, I had issues with sound. So hopefully today you guys can hear me, and yes, I think that you guys are amazing, and you should stay beautiful, stay wonderful, stay awesome, stay unique, stay you. And above all else, you guys love yourselves. Have a wonderful, beautiful day. Peace and love, you guys.